Chronic pancreatitis. So what are the causes of chronic pancreatitis? The etiologies are two. One is the alcohol and the next is the stone. The main cause is the overconsumption of alcohol. Means drinking too much of alcohol will cause chronic pancreatitis. And the next common cause is the stone in the lower end of the CBD, common bile duct. So remember, it's in the lower end of CBD, not just common bile duct. The stone will be in the lower part of the common bile duct. So what is the pathology? There is always a stricture or multiple strictures of the pancreatic duct. There is always a narrowing, a point which is narrow, or maybe multiple narrowing of the pancreatic duct itself. Irreversible replacement of acinar cells with fibrous tissue. So the acinar cells are replaced with fibrous tissue, which is scar. And this has no solution. It is irreversible. Gradual loss of both exocrine and endocrine function. So it loses both exocrine and endocrine function slowly. And in few cases, inflammation and fibrosis of the head of the pancreas may obstruct the lower part of the CBD, leading to obstructive jaundice. So in some people, there is inflammation and there is fibrosis of the head of the pancreas. So this head, when it is fibrosed or maybe inflamed, will obstruct the lower part of the common bile duct. And the outcome is the obstructive jaundice. Did you notice in both of the things it's the lower part of the CBD, lower end of the CBD. So lower end word is important. So we have clinical features. Symptoms. Okay, what are the signs and symptoms of chronic pancreatitis? We have 4: epigastric pain, malabsorption, diabetes mellitus, and few other physical signs. So epigastric pain. So this pain, which is in the epigastrium, this will radiate to the back. So you know this is chronic pancreatitis. This pain may be mild or maybe it's very severe. It may happen all the time, which is continuous, or maybe sometimes like interrupted. So this pain commonly causes drug addiction for analgesics because the pain is like maybe all the time, maybe mild or maybe severe or maybe continuous or maybe comes and goes. So these people have drug addiction for analgesics because they take painkillers a lot. Secondly is the malabsorption from loss of enzymes, which produce steatorrhea in 1/3 of the patients. Together with loss of weight, weakness. Stools typically are soft, greasy, and foul smelling. So these patients, they have malabsorption because they do not have enzymes to absorb. So you can see in their stool, it's steatorrhea, okay, in 1/3 of the patients. And so these patients also have loss of weight. They look thin. And also weakness, like they're weak. So their stools, how does it look? These stools look soft, greasy, and they smell bad, foul smelling. Okay. So the third one is diabetes mellitus. Develops with extensive damage of the pancreas. So when the pancreas is too damaged, then only the diabetes mellitus appears. Right. So it occurs in 1/3 of the patients. There are a few other physical signs like malnutrition and a tinge of jaundice. In 3% of cases may be evident. This is epigastric tenderness. Yeah, right. There is also epigastric tenderness. Few other signs like malnutrition. As we know that already there is loss of weight, so this patient will also be malnourished. And then you can also see tinge of jaundice. As we know, we talked about it earlier. There was obstructive jaundice because the inflammation and fibrosis of the head of the pancreas obstruct the lower part of the common bile duct. So it leads to obstructive jaundice.